Fatty liver isn't just a liver problem, it's linked to serious diseases like diabetes. We've discussed fatty liver in several videos. Recent studies show that fatty liver is becoming a major cause of high blood sugar. Today, we'll explain why. I'll share 5 important tips that can help reduce liver fat and lower your risk of developing diabetes in the future. Fatty liver occurs when more than 5 to 10% of your liver cells accumulate fat. This is called fatty liver disease. If left unchecked, fatty liver can progress to liver fibrosis, cirrhosis, and complete liver failure. Most people don't realize this. One simple way to check: stand straight and look at your belly. If abdomen sticks out, fat may be accumulating. The most accurate way is through an abdominal ultrasound. Another important test is the liver function test, ALT and AST. If these tests show fat or elevated liver enzymes, check your HbA1c, which measures average blood sugar over 3 months. Many patients with fatty liver are pre-diabetic, meaning first stage before diabetes. Without intervention, pre-diabetes can progress over 5-10 years. Here's what happens inside your body. Your body produces insulin, which moves sugar from blood into cells for energy usage. In people with fatty liver, insulin sensitivity decreases, meaning insulin doesn't work properly. The pancreas responds by producing more insulin. If this continues for several years, the insulin-producing beta cells start to fail, leading from insulin resistance to type 2 diabetes. That's why it's critical to detect fatty liver early and take action before more serious complications develop in the future. The first and most important step, supported by research, is losing 7 to 10% of body weight in 2 to 3 months. This can significantly reduce liver fat, lower the chance of developing diabetes. Maintaining weight afterward is essential. Remove white processed foods from your diet: white flour, refined wheat bread, white rice, and added sugar. Avoid hidden sugar sources. Stop adding sugar to drinks like tea, soda, or diet drinks. Hidden sugar is also in sauces and packaged foods. Incorporate healthy fats in moderation. Add almonds, cashews, stewstay, walnuts, and olive oil. Healthy fats help you feel full longer. But don't overeat. Keep daily nut intake around 15 to 20 grams. Fiber helps reduce fat absorption and keeps cholesterol under control. Include leafy greens, salads, seasonal fruits, chia seeds, flax. Fiber helps you full and supports weight loss. Start with a brisk walk, fast enough to raise heart rate, but still able to talk comfortably for best results. Aim for 150 minutes per week, as recommended by the American Heart Association. Walking supports liver health and maintains healthy blood sugar. As you progress, add light strength training or gym exercises. Small, consistent changes over 6 to 8 months produce real results. You'll notice more energy, reduced fatigue, and gradual improvements in liver health. There's no shortcut. Lifestyle changes are the only way. I hope you found this video useful. Like, share, and subscribe for more health tips. Take care of your liver and health.